Welcome to episode 33 of America in Crisis, Breaking the Cycle of Addiction. My name is David Hunt and I am your host. Please set your DVRs to record. The show could save your child's life. We will start with a report from the Massachusetts Department of Public Health. In the first 9 months of the year 2020, there were 1,340 opioid-related deaths, with an expected 47 or so more for the remainder of that year. Today's guest is Katz. Aaron is a master of public policy and is the Vice President of Behavioral Health Services at Eliot Community Human Health Services, where he has fostered an environment that ensures the highest quality of services throughout the development of high-performing teams. Aaron has developed training and processes that create autonomous leaders focused on the development and motivation of all team members. Aaron has been with Eliot since 1999 and has received his master's in public policy from Johns Hopkins University in 2005. His focus for the last 12 years has been on creating management and leadership systems that promote continuous improvement for both staff and persons served. Aaron continues to spend time working directly with teams providing services and training for new managers and seasoned leaders to increase their ability to offer effective services. I met Aaron last week on a Zoom call for the Melrose Wakefield Behavioral Health Alliance, where we are both members. Aaron was a presenter, and as soon as I heard about Eliot, I knew these services had to be shared with our guest. Aaron, welcome to my show.
Thank you.
Okay. Aaron, I don't know where to start. Eliot has so many different services you provide. I want to try my best to focus on addiction and behavioral health, if that's okay with you.
Great.
Okay. Aaron, what can you tell us about the mission of Eliot Community Human Services?
So our mission, you can find it on our website, but to put it simply, we are looking to serve, people in the Commonwealth who suffer from addiction, behavioral health issues, children that might be in DCF services or DYS services, and we want to serve people across the age continuum.
And where are you centrally located?
So our corporate office is in Lexington, but we are all over the Commonwealth. We have clinicians as far away as Pittsfield. We're in Gloucester. We're down on the Cape. Where our services really are everywhere in the state.
And what communities do you basically serve? You
Well,
can list a bunch of them.
Yeah. Other than we're all over the Commonwealth, we are a lot of our behavioral health services are focused in the Lynn, Tri-City area, Malden, Everett, all the way through the North Shore, through Haverhill.
And what services do you provide people with for substance problems and addiction? What do you offer? If I was to call you today, what do you offer us?
So it depends where you call.
Okay.
We're really excited about the state's launch of the Community Behavioral Health Center programs, which we're operating two. So one of those is in Lynn and one of those is in Danvers. So if you call those, we would have you come right in to get assessed. And really what we're offering right away for folks is recovery coaching.
Okay.
We've launched recovery coaching services throughout our programming, and recovery coaches really are the backbone of our substance use services.
Now, you were recently in the paper and in the news you took in, I think, 50 people from Mass and Katz. What can you share with us about what you actually did for them?
Sure. Well, first I'll say it wasn't me in the news. It was Eliot.
It was Eliot. Yeah.
But I think it really was a partnership with Commonwealth Care Alliance that we developed with the state to address what was happening at Mass and Katz. So, and there were a number of partners, Pine Street, a number of other homeless providers, behavioral health providers, looking to try to help solve what was happening at Mass and Katz. We partnered with Commonwealth Care Alliance, or CCA, and the state to develop what was called the Cottages program, which is on the grounds of the Shattuck State Hospital, where we are partnering to bring people directly off of the streets of Mass and Katz, unsheltered folks, into these little cottage environments and supporting them with nursing and behavioral health supports to get them out. From there, we have these incredible staff, and this is where we ended up in the news, where we have these staff that just are amazing at getting people housed, taking people who been living on the streets or in a shelter and just getting them housing, and it was a couple incredible stories about what our staff and the clients achieved.
So it's good to go down there and help them. I know a lot of organizations go out there, bring them blankets, bring them food, but the whole basic mission and cure for this, basically, cure's a bad word, but is to get them off the street into the programs that they want.
Yeah, it's really hard to solve addiction and behavioral health when you're homeless, right? When you're just trying to figure out how to stay warm for the night. So absolutely, there really has been incredible partnerships around trying to solve that, and we've been lucky to be a part of that.
No, I've seen an incredible challenge, not just Eliot, but all the community services. With so many of the homeless now with addiction and substance problems, how do you deal with this?
Well, we're really fortunate. We've got some great leadership and staff who do this work around homelessness. And the approach is really simple. You have to house people, and you have to treat them at the same time, and you have to take an approach, what's known as harm reduction, right? And so you have to be willing to, accept that people are going to continue to suffer from their addiction and their behavioral health, and treat them and still house them.
Yes.
Yeah.
Now, when they come into your facility, I'm sure there are many different types of substances. What are the common ones that you see that you have to treat? What do you find when they walk in the door? What are they on?
Yeah, the two biggest problems right now are just sort of obvious, right? Opioids and fentanyl, and we see this all of the time, and that's what we're struggling to treat. The other one that we see in our community is still crack cocaine, and combined with the opioid epidemic, that is sort of what we're focused on. And again, we have a harm reduction approach. We have excellent physicians and nurse practitioners that start medication-assisted treatment right away.
Is part of the problem that the people that are taking heroin and opioids aren't aware of the fact that fentanyl is basically mixed in with everything? So they think they're getting coke, they think they're getting crack, they think they're getting heroin, and surprise, we've got deadly fentanyl mixed in.
I mean, I think that's a fair statement. I'm not an expert on addiction. On the treatment end, our goal is really to make sure the services are there for people when they need them. For me, I leave the research in the why to others.
Yeah. I just figure that the people are coming in, they don't realize what they're getting on the street. Back when we talk audience viewers, you don't know what you're getting. And this is what I'm trying to get at, is it doesn't, I've used this phrase so many times, our heroin isn't meeting the good keeping housekeeping seal of approval. You don't know what you're getting. You're getting your heroin from one dealer, you're at Mass and Cass, another dealer comes by. It's not consistency. You don't know what you're getting. You think you're getting, even a joint now is laced with fentanyl. So this creates a tremendous problem. As an EMT, what did you take? Oh, I just took some heroin, I just took a joint, and he's having an overdose because it's laced with fentanyl. And this is very, very deadly for the people that are using the drug. Because I'm not recommending you stick with one drug deal. I'm not giving you advice on how to buy your drugs. But if something's working for you, first, by all means, try to get off the drug. But if you're on a drug, you don't know who these people are, where they're getting the product, what they've cut it with, what they've mixed it with. Every time you use a drug, you're putting your own life at risk. There's no real answer to this other than to seek help to get off the drug in the first place. And this is why I do this show. And we have guests such as Aaron, companies like Eliot, that can show if you want to get off the drug, and you really do, there are places you can go to get off the drug. Help is out there. So, Eliot, you do a lot of options. What other treatment options do you offer?
A lot of our focus is on behavioral health.
Okay.
So in addition to addiction, we are working to, what's known as focus on what we call zero suicide in our services.
Okay.
So, and within our CBHC programs, Community Behavioral Health, Center programs, that's a large part of what we're doing. So we're assessing people for their lethality or where they're at with suicide from the beginning, and we're starting treatment for suicide. In addition to that, what these CBHC programs are allowing us to do is to offer outpatient services in a way that have never been offered before in community mental health or in a Medicaid, Medicare reimbursement model,
Okay.
where we can offer individual therapy, group treatment, skills coaching, medication management, recovery coaching, peer specialists, case management, family partners, nursing to help with care coordination, really providing an array of services that have never been available in the public sector. These are, what I'm describing is what you would get if you were in a private pay situation. People who have the means to treat depression or suicidality, they get a group, they get multiple groups, they get skills coaching, they get an individual therapist, they can call the therapist between sessions. That's never been made available to the public, and that's really what is exciting about these CBHC programs, is that we have this vision from the state and the funding to back it up, that we are able to create services to really address the other crisis in America, which is the mental health crisis, the behavioral health crisis. What we're seeing is just constant need to address people's mental health and well-being.
I can understand that. I mean, years ago, there was only so many things out there that you could do, and that's why so many people returned to the facilities, because they were just getting group and individual one-on-one with this type of resource. You can call your therapist, you can go back, you've got so many things, you're offering so many things. This is what I meant at the beginning, I don't know where to start. But I mean, they sound like fantastic programs that have just never been offered before, giving them a fighting chance, not just, here's your 10 days, here's your 20 days, you're out on the street.
Right. Right. Yeah, we're really looking to not discharge people. We're really looking to figure out what are the best ways to engage someone in the treatment that they want or need, and how do we give them something that's intensive over a period of time to help them move on in their life, so that we can help the next person. Really creating access.
Now, do they live at your facility, or is this just a day program, or just multiple?
So that's a great question. So our services through CBHC are open during the day. We're open Monday through Friday, 8 a.m. to 8 p.m. We have weekend hours as well, where we can provide treatment, and then we have a 24/7 component.
Okay, that's okay.
Which is what's known as the Mobile Crisis Intervention Team. So we are providing immediate assessment and access to people, but that also involves follow-up. So it's not just an evaluation process to determine, does someone need to go to a hospital? Does someone need to go to detox? Does someone need to go into further services? But we're able to give people follow-up after that evaluation process. So that's 24/7. We also have what's known as like a crisis stabilization unit at each of the CBHCs, where there is a 24/7 residential component for treatment. So we're treating people for behavioral health for days, weeks at a time, to help stabilize them so that they can move on in their treatment.
That's unheard of that you're able to do this now.
Yeah, I mean, there's a lot of need out there.
We've come a long way. Now, how do I get in your program? Do I just walk in the front door and say, honey, I'm home? Or does somebody have to refer me?
So it really is the person or the child family coming to us.
Okay.
And that, people can go on our website, they can reach us through the behavioral helpline. You can call our number, which I will share, I think, today. So we have a 24/7 number for both of our sites, and you can call and come right in to access care. There are there's always some catches in these things and some payment issues. Right now, CBHCs are fully open to people who have Mass Health and people who might have Mass Health and Medicare. Some of the private insurers are looking to reimburse us, but that hasn't been finalized yet. And people at the state are working on that.
If they don't, what's it going to cost in the long run for their care or their injuries?
Right.
You spend $1 to save a dime.
Right.
And hopefully they see the light on this. Now, you've mentioned Lynn and you mentioned the Tri-Area. What are some of your other facilities, where they're located, and what do they have to offer for program? Is it different than Lynn, or what if I went to one of your other facilities? What could I expect to find there, Aaron?
Sure. So in Everett, for example, we have a clinic in Everett, an outpatient clinic. We also offer urgent care services there, meaning people can access care after 5 o'clock or on the weekends. People can be intaked quickly. We do some group work there, individual therapy, med management. We serve children and families as well as adults there. We also have our Family Resource Center in Everett, which is an open access program, meaning it's there for kids and families to get resources and supports that they might not get otherwise. And that's an amazing program. The folks who run that program every day in and day out really serve the greater Everett area. We get referrals from Chelsea and Somerville and Malden and Melrose. So it's a really great program.
If I walk into Everett and say, hey, I'm on heroin, I want to get off of it, I've been on it for 5-6 years, where would you send me? What would you do with me?
Well, there would be a conversation around, are you going to do some medication-assisted treatment with us starting right away? Are you looking for detox? Do you need to come to one of the CBHCs for further evaluation? So there would be a triaging process to really figure out that moment, what can we do to help you?
Yeah, my parents threw me out, they hate me, I don't want to live anymore. Is it better if I just end it and die now? Now, yes. What would you do with me?
Yeah, so when folks start to talk in those terms, we would be looking for an evaluation to make sure you're safe, right? And make sure that language around self-harm or suicide can be managed, and we would look to support you to keep you in the community.
So it's an all-around, it's a 360 basically, looking at all angles, not just the drug, but my mental being, why am I on the drug?
Right, and I think if homelessness is involved, we've got our homeless team that's available in the Everett Malden area, but really statewide, and we do provide those services to anyone who might need it.
What can you tell us what a behavioral health community partner is? We keep seeing the word go around, the BHCC. What is it?
Yeah, so behavioral health community partners, or BHCP, they are a care management program that supports the accountable care organizations. So not to put out too many acronyms.
Yeah.
The ACOs, so partners or steward, or I shouldn't say partners, MGB.
Okay.
Some of these large organizations are these ACOs. They have Medicaid individuals that they serve through primary care, and they need to get support for those who have more intensive behavioral health needs. And that's what a BHCP, or behavioral health community partner, comes in and does. They help care manage the needs of people who are receiving Medicaid through an ACO.
Is there an age limit to walk in? Do you do children? Do you do teenagers? Is there such an age? Or is it just old people like me?
Yeah. So our BHCP program doesn't serve children, but we have another program, CBHI services, that do serve kids. Our CBHC services, and I'm talking in acronyms, so I apologize to anyone watching this, but we do serve kids and families in that way as well.
Okay, as more people are having behavioral health issues, are you seeing your role increasing over time?
Absolutely. I think that what we've learned and what we've seen out of the pandemic is the need has only increased. And even with CBHC launching on January 3rd, the demand for services is only increasing. And other kinds of clinics like that we run in Everett or Concord and other places, they have wait lists, right? And so the goal here is to continue to figure out how to open access for people.
With more and more people turning to drugs, especially after getting over COVID and financial crisis, what are you doing to meet the challenges of alcohol and drugs? I know you're going to be getting more patients.
Well, some of it, comes down to partnering with other community providers, whether it's police officers, other agencies, identifying people who might suffer from addiction or who are beginning to suffer from addiction so that we can get them into treatment.
Seems like you've been doing this for a while. How long has Eliot been in existence?
So the original Eliot started in the 50s.
Whoa!
And
I wasn't even born then.
It was part of the first wave of community mental health centers. So our Eliot Center is named after Abigail Eliot, and that's our Concord clinic. And so we've grown through a series of mergers and opportunities and growth in this area.
Now, you must have some people that help you along the way. How do you interact with DCF and DYS?
So we partner with DCF, DYS, DMH, DDS, MRC, lots of the state agencies to provide services to them. So they contract to us. But they also send us referrals, right? So DCF, a DCF worker might have kids and families on their caseload that they need to help receive addiction services. So they'll refer them to our Ever Clinic. So it's a lot of partnering with those organizations and agencies.
That's great. You've got cooperation that one can call and get help with the other one.
Right.
That they respect you enough to know what they're going to get for care.
Right.
You can't be too careful nowadays. I mean, there are fly-by-night agencies all over the different states that they just want your money, and once that's exhausted, that's it. So you got to really know where it's going. Now, I read on the website something called the NAN Project. What can you share with our viewers about this project? It sounds fascinating.
Yeah, I would recommend to folks to go on the website and read about NAN. The NAN Project is an amazing organization. It's peer-led, so it's run by young adults who go into schools and tell their stories around struggles they've had around suicidality, depression, and mental illness in general, to help young adults deal with what they have going on. Actually, my daughter, for a project had in her school, she brought in the NAN Project into her class and actually had them come and speak to their classes. And so it's a really great program to help prevent larger issues that can occur for someone later in life.
It sounds good that they're hearing it from their peers and not from doctors and social workers and therapists, but someone that's been through it that can relate to them, someone just like them that's probably been through it.
Yeah, exactly. Similar to recovery coaching.
Yeah,
so when I was talking about substance abuse services earlier, the recovery coaching services really are key in that model of that peer-to-peer feeling to help people recover.
Now to hit you with a trick question. You've been around since 1958, approximately since the dawn of time. How many people have come through your doors that you've treated?
I honestly don't know the total because
Roughly.
I also wasn't around at that time. But what I can say is, we serve, roughly on an annual basis, 35,000 people every year. And each year. And a lot of that is due to our homeless services. A lot of people come through our homeless services. A lot of folks come through our clinic services. So our public services that are open to everyone end up taking a lot of people.
I was just going to get to that. For the amount of people you serve, how many people roughly are involved in Eliot on your staff, if you want to reuse that word, in the facilities? How many people are under Eliot?
So we have around 2,000 folks working for us, and that's a combination of full-time staff, part-time staff, per diem staff. So yeah, it's about 2,000 staff.
Now we've discussed DYS and the other agencies. What other agencies do you partner with, or work? Partner's a bad word. Are you affiliated with?
So MSPCC is an affiliated organization within Eliot.
What's that stand for, please?
Hopefully I get it right. Massachusetts Society of Prevention of Cruelty to Children.
Okay, yeah.
I think I nailed it. But that's a great organization. It's an advocacy organization within Eliot that is up at the State House making sure that our legislators understand what's happening for kids and families in the Commonwealth. In addition to that, you mentioned the NAN Project.
Yes.
That's another affiliate within Eliot. But beyond that, I mentioned Commonwealth Care Alliance. They're an agency we partner with. All of the state agencies like DMH, DCF, DYS, DDS, MRC, they're huge partners with us in the community, as well as places like Melrose Wakefield Hospital, MGB. We're looking to partner with every organization that's in the communities that want to help. Specifically in places like Lynn, I'd be remiss to not mention Lynn Community Health Center, which is a huge partner to us.
You're doing a lot with Melrose Wakefield. I saw you on the last call with the district attorney, and you're going to be speaking in a couple of days, I understand.
Right, I'm going to be talking to them, same kind of conversation. What can we do, to partner around what's happening around addiction and behavioral health to get people into services? The other thing, I just want to mention is,
sure, go ahead.
That we're also doing a lot of jail diversion work. So when you mention these communities or the district attorney, we're funded through the Department of Mental Health to have clinicians embedded in police departments to help identify addiction and mental health issues early when they come into contact with the police.
Now, you're a nonprofit, obviously, and you just mentioned you get some funding. What happens to the actual patient that comes in? I say, I need help. I'm on the street. What I have is what I'm wearing. What do you do in that case?
So, unfortunately, our system is somewhat Byzantine in that a lot of what we do is trying to figure out what are the best ways to address a scenario like that. So, does the person have insurance? Do they qualify for some sort of immediate assistance? Do we need to evaluate them for their safety and get them into, as I was saying, like a crisis stabilization unit? Are there issues of addiction where we need to be looking at detox? Is it just an issue of homelessness and we need to get our homeless team involved? So a lot of it is that teasing it out and figuring out what they're qualified for. And I think that's what can be very frustrating to someone or a kid or a family, is that they come in thinking, they're going to just get all of the help they need. And a lot of what we have to do is figure out what can we access to get them the help.
Do you guys do fundraisers at all, events, or is it all through the state and through donations?
We mostly are funded through contracting and these third-party sort of insurance reimbursements or alternative payments. But we do some fundraising. So MSPCC holds an amazing gala that's coming up at the end of this month. And so if you could check out our website, that's there, and there's an opportunity to donate there. But that's probably our largest event. The NAN Project also does some fundraising. Their event was just, I believe, in the fall as well.
So basically go on the website and look at this gala that's coming up.
Yeah, exactly.
And can people just make a donation off the website to say, I like what you're doing? Can we just go on the website and donate money?
Absolutely, yeah. That's the other option as well. There's like a donate now button there.
Yes. Not going to turn down money ever.
No, not going to do that.
Now, I've asked you with a slew of questions. Anything that I haven't asked you, you'd like to talk about, something that you do that I haven't mentioned?
Yeah, I appreciate being able to come on here and talk to the public. I think there's a lot of work that needs to be done in behavioral health, addiction, and I think what the state has done around the CBHCs really is tremendous. But there's still some work that needs to be done on that to continue to make sure access is available and people can get the treatment they need right away.
That sounds awesome. I've been on your website. Like I said, we can do an entire show on everything you haven't mentioned here today. Which, don't laugh, I might have your partner come in and talk about everything we haven't mentioned. Okay, we can check out Eliot's website, viewers. We can check out the website, which will show on the screen for other services they provide that have not been discussed today. And that, of course, is eliotchs.org. Okay, I'd like to present to Aaron Katz, our first recipient. You'll see this on the screen. Aaron, thank you very much for appearing today and for all the work you and Eliot have done in the past. You're our first recipient of this.
All right, thank you.
Great, thank you. Before our closing, just want to say a couple of words like I always do. For our viewers that have been following me, yes, I've been doing a lot better. I have to thank the amazing surgeons over at Tufts Medical Center. As you can see, I'm looking a little bit better. There's been a gap in my shows due to a little bit of recovery, but if it wasn't for the surgical staff and all the help I've got at Tufts and the continuing care, I wouldn't be here today. So got to give a big shout out and thanks for Tufts. I'm trying to get some of their doctors on to talk about what services that they can provide that have to do with addiction and substance. But if it wasn't for the center in Stoneham, the people that have been treating me for the last year, I can never thank them enough. And it just shows what modern medicine can do nowadays. And of course, Eliot, look what they're doing for 50, 60 years. Look what they've been able to do for people suffering from addiction. So we all have our own type of problems. Mine might not be addiction, but everybody with a problem, there's a solution for. And I can't thank Eliot enough for what they've put on for the last 50, 60 years. Okay, in closing, I would like to thank our guest, Aaron Katz, for appearing today. As always, thank you for watching. Please share this program with your social media friends. You can contact Eliot Human Services at 781-861-0890. If you're not in an area currently serviced by Eliot CHS or its affiliates and other departments, you can contact the Massachusetts Substance Use Helpline, and that's toll-free 1-800-327-5050. And now the Mass Helpline also can help you with gambling addiction. Yes, you might see them on shortly talking about addiction for gambling. The show can be seen on a rotating basis on Woburn Public Media stations and on demand at their website and on YouTube. As always, thank you to the staff of Woburn Public Media for making this show possible. Please enjoy our closing theme, Rise Above the Noise by Fireheart. So the credits for important contact information. And that means listen all the way through. We have contact info for past shows you might be interested in and help you can receive from other people that have been here. For America in Crisis, Breaking the Cycle of Addiction, I'm David Hunt. Again, thank you for watching. Until next time, be safe.
Above the noise, you hear us cry. There are people who care. Listen to the sound in the air. Rise above the noise in the air. The sound not heard is what we bear. Listen to the sound if you dare. Rise above the noise in the air. The sound not heard is what we bear. The whispers that I hear behind my back are those who never lost a child, a friend. So they lack a sense of loss, a peace that's gone with no return. Above the noise is how we cope. Above the noise is how we learn. The most important things in life I found comes deep within the heart, the purest sound.